Hi guys, in this video we're going to talk about pain management in the medieval era. So as a general practitioner or family physician, pain management is a big part of my job, and I found it really interesting exploring how pain was managed in the medieval era in contrast to how we manage it now. So if you share my interest in exploring medicine through the ages, please do subscribe to my channel, Doctor of the Ages. So in medieval times, scientific knowledge of medicine and pharmacology was quite limited. So when managing any kind of pain, herbs were normally used. The type of herb used was based on tradition, trial and error, and empirical observation. So one of the herbs used that most of us will have heard of is opium. So looking at the science first, we know that the active compounds in opium include morphine and codeine, which a lot of us will recognise as strong painkillers used today. Compounds in opium will bind to opioid receptors in the central nervous system and block pain signals. So that's essentially how it works. In the medieval era, opium was quite rare and valuable, so it was mainly accessible to people with either power, wealth, or medical authority. So surgeons would use opium, sometimes even in combination with alcohol, to intensify its effects during and after operations. It was also used to alleviate the pain caused by traumatic injury like fractures or burns, and other known indications for use included labour, insomnia, diarrhoea, and cough suppression. So nowadays, opioid drugs like codeine and morphine are used in the management of both acute and chronic severe pain, and we can now see that this has been the case since medieval times. Another herb used was willow bark, and this herb contains salicin. Salicin is metabolized in the body to one of the active ingredients in aspirin, which most of us will recognize. This ingredient works to inhibit a group of hormone-like substances or prostaglandins, which are usually released after injury or illness to cause inflammation and pain. So willow bark was quite readily accessible and inexpensive, and usually local village herbalists would have access to it, and this made it both a valuable and common resource. It was mainly used to manage headaches, toothaches, muscle pain, and general aches as well. It was used to reduce fevers, and its ability to reduce body temperature made it a valuable herb in this era. Occasionally it was made into a paste and applied topically to painful or inflamed areas of the skin. So all in all, willow bark was cheap, it was readily available, and it had anti-inflammatory properties as well as fever-reducing properties. So nowadays, we do use ibuprofen or Advil more as an anti-inflammatory due to it being better tolerated by most patients, but aspirin is still used by some patients, and it is known to be an effective anti-inflammatory. So turmeric was another popular one that has been found to have quite potent anti-inflammatory properties. So it contains curcumin, which inhibits various inflammatory pathways, and it was used in the medieval era to treat conditions like joint pain, arthritis, swelling, and sometimes alleviate indigestion or abdominal discomfort. It was also used topically and applied to wounds, burns, or infections. Ginger did work in a similar way as well to reduce pain and inflammation. These two herbs were considered an exotic luxury spice in Europe, whilst they were quite widely available in the Middle East and South Asia. And for this reason, it was mainly reserved for the wealthy or those with access to trade routes. Many studies today have shown ginger and turmeric to be effective anti-inflammatory agents. Curcumin and ginger extracts are taken today as health supplements or tablets to target managing conditions like arthritis and other inflammatory disorders. So actually, these were both used well and appropriately in the medieval era, if you could get hold of them. Wormwood was another herb that was used, and this works slightly differently. The thujone in wormwood acts on what we call GABA receptors to produce a stimulating and sedating effect, thereby helping with pain. It was quite a versatile herb in the medieval period. It'd be used for conditions like joint pain, muscle soreness, fever, expelling worms, and digestive problems. It was quite readily available in Europe during the medieval era, as it did grow quite abundantly in temperate climates, so you would usually be able to get this from the local herbalists. Wormwood is still available nowadays in the form of a cream, and it's used to relieve arthritis-related pain. But unfortunately, there isn't enough evidence to support this as a parasite or worm eradicator. So lavender was also used for pain relief and has been shown to have anti-inflammatory, muscle relaxing and calming properties. It was mainly used to treat muscle aches, headaches, digestive discomfort and stress-related pain. It was used both topically, so in oils and baths, and internally, so in teas or tinctures. And due to its properties, it was used a lot in aromatherapy to alleviate pain and promote relaxation. It was versatile and widely accessible, and it was quite popular given it provided both physical and psychological relief for various forms of pain. So nowadays, there is evidence that lavender can help with pain relief, and it remains a popular herb used today in aromatherapy. The last herb we're going to talk about is peppermint. So it contains menthol, which is a cooling effect when applied to the skin, thereby reducing the perception of pain. It was used for muscle pain, joint pain, headaches, migraines, and also sometimes topically for minor wounds and abrasions, given its antiseptic and anti-inflammatory properties. Peppermint tea was also quite popular to try and calm the stomach, help with nausea, and reduce intestinal pain. It was relatively available in the medieval era, and you would usually be able to get it from your local herbalists. Nowadays, peppermint oil is still used to help manage joint pains and headaches. I have personally prescribed peppermint oil capsules for a lot of patients with irritable bowel syndrome, and it does alleviate digestive pain. So the uses of peppermint remain similar throughout the ages. As most of us will be aware, alcohol was used a lot due to its numbing and sedative properties. It can also relieve pain due to its depressant effects on the central nervous system. It releases endorphins too, which are hormones that act as natural painkillers. There was lots of different ways alcohol was used. So it was used to create tinctures, so sometimes combined with some of the herbs we've discussed earlier, and used either topically or ingested to provide pain relief. It was also used before and after surgical procedures, like amputations. Hot wine as well, infused with herbs, was another popular remedy to try and help with fevers and flu-like symptoms. Nowadays, we don't really recommend alcohol as a pain reliever because of its long-term harmful effects on the body. We also know that our body will develop tolerance to alcohol as a pain reliever, so you need to end up drinking more and more to get the same effect, which isn't ideal. So this video has hopefully given you the idea that while medieval people didn't have the modern understanding of most compounds they used, their use was based on centuries of accumulated experience, and some of this has now been validated by modern pharmacology. So many of the active compounds in the medieval herbs are used as painkillers in modern day medicine, and some as taken as evidence-based health supplements. So if you enjoyed this video and found it informative, please do like and subscribe to my channel, Doctor of the Ages. Thank you.